Good evening, everyone. Hi, it's Thursday, and we are here again for our Facebook Live on nursing prioritization and delegation. And of course, we have something on the screen right now. It's Bibiana. She passed her NCLEX, so congratulations. She says, I want to say thank you so much for what you do. I have passed my NCLEX-RN thanks to you and your videos. I have learned so much from you. Well, thank you. Yes. So again, we have another session for tonight. So thank you for coming over, everyone, and really listening every Thursday. And I hope that our program is helping you every week. And finally, hopefully, you will reach your goal, which is to pass the NCLEX examination. Okay. However, before anything else, I would like to introduce myself. My name is Mr. Alan Matus. I am a nurse educator, and I have been a nurse educator for almost 25 years. And currently, I'm also nursing faculty. I help students pass their nursing program. And also, I'm the founder of Matus Nursing Review and Matus Nursing Review Online NCLEX Academy. And of course, I have my book published in Amazon. Okay. So this is the book. The title is Simple, Fast, and Easy NCLEX Review. Okay. It's also now available in the Philippines, and of course, you can email Matus Nursing Review Academy at gmail.com if you want to order in the Philippines. Okay. But then you can find this in, of course, as what I have said, in Amazon. Okay. So you can order the book there. But anyway, everyone, thank you very much for being here again. Of course, I would like to give a shout out to the following people who just came in. All right, so we have Jenny Ramos Peña, okay? Sale Morante Aquino. Hi, Sally, how are you? Pravina Pothakamuri, Ursula Ogbenta, Joyce Jamila Flores. Yes, Fresel Paz, Noel Burgos, Benedicta Enteseague, Memi Lawal, Cadiato Trawale, Swetzel Boseco Escobar. Swetzel actually already passed her NCLEX-PN, so it's nice for you to watch again the videos here. And then, of course, we have Gian Torres, Abegay Nanes, Chinonso Florence, and then also we have JD Matthew, Modo Ginibil. Okay, so I'm gonna continue later on reading more shout outs for all of you guys. Okay, there's a lot in the comment section. But anyway, put more comments, everyone, because if I like your comments, then I'm gonna put that on the shout out, of course. Okay, so I'm gonna post that in the live session that we have right now. So next, everyone, what is our agenda for tonight? So the first thing, again, we're gonna have our testimonial. Okay, so our testimonial so far, I think of all the testimonials that I have for the NCLEX review program, I think this is the longest one, I guess. You know, so Cheryl actually just passed the NCLEX recently, and she sent us a dedication, you know, or a testimonial. So she said, finding resources for the preparation of NCLEX was quite a challenging for me, but thanks to Ms. Matus Nursing Review for NCLEX, I passed my NCLEX exam with 75 questions. I enrolled in a 12-week fast-track online program, which had a live discussion every Thursday night, and it comes along with a workbook and a book, which is a simple, fast, and easy NCLEX. The workbook is well organized, and the book is affordable, and it will really prepare you to brush up and build a strong foundation for your nursing content. I highly recommend it as a great resource for NCLEX preparation. Also, the online academy has lots of great resources for your preparation review, like nursing skills videos. I recommend you to watch those videos and study the high priority conditions list in the NCLEX. The videos of Sir Alan, the video lectures of Sir Alan in the academy, okay, in the academy, all right, let's continue, is easy to follow, and the way he did this discussion is like sitting in the classroom and listening to your professor. It is engaging and easy to comprehend, and I watch over and over again. Like Sir Alan said, watch till you understand and sticks into your brain. I also attended most of his Facebook Live every Thursday night, where Sir Alan will guide and teach his students how to approach prioritization and delegation questions. Sir Alan will guide you on how to tackle those questions in an easy way. If I miss a Facebook Live, I watch them the following day and carry my workbook all the time, even I'm at work. Indeed, Matus NCLEX Review is an excellent prep for NCLEX, and I will continue to use Matus Nursing Review for my NCLEX-RN preparation. So thank you, Sir Alan, for being a motivator and for your kindness. I am very grateful. So again, congratulations, Cheryl, for passing your NCLEX-PN, and again, for deciding that you still want to use our program again for your NCLEX-RN examination. So thank you. So I think that's the most important thing for me, that the students appreciate the program. You know, it's the quality of the program that is the most important factor, you know, that we consider to make sure that we are successful in delivering our service to the students. Okay. Now, another one, everyone, for tonight, before we start, just two more slides, I promise, okay? We have here a comment from Bibiana. So she said, thank you, it is a great feeling. Delegation and prioritization is a big part of NCLEX-RN. Good luck, everyone. So that's what she said, okay? And then Ursula said, everyone get the book and join the academy. He is great. Thank you, Ursula. She's one of our students right now. Okay, now one of the things that we're adding to the academy as well now is we'll put this in the online academy today or tomorrow, but this is the NCLEX study calendar. So I really encourage students to use a study calendar in preparation for the NCLEX, and every student has their own time schedule of when they're going to take the NCLEX. So you have to palpate yourself on how prepared you are for the NCLEX, and then you can put the topics in this calendar and also how many questions you're going to answer per day, and make sure that you have breaks in between, because you want to make sure that your brain will be able to rest as well from all the information. Okay. So also, to fill out this calendar, you can use the 15-day study plan that we have. So all the topics in the 15-day study plan checklist, you can put them in the calendar so that you know when you're going to do them. Okay, and don't forget that you also have to put your practice questions for the day as well. Okay, at least 75 to 150 questions every day. All right, and always remember, you have to study your content before you do your practice questions. Okay. All right, so I hope that the calendar is going to help our students. And of course, just a very quick announcement. All right, so on Saturday, we're starting our first session again for the 10-day live comprehensive NCLEX review webinar. It's going to be this Saturday from 8 to 4 p.m. It's going to be January 30 up to April 3, 2021. So I'm so excited to meet our brand new students attending that class, okay? And also for the previous students that I have, if you want to attend a couple of days, then just let us know. Email us so that we can accommodate you to attend some of the lecture days again for this 10-day lab comprehensive NCLEX review. Okay, so fasten your seatbelts to those students who are attending this program this Saturday. So it's really very exciting, everyone. Okay, all right. So again, everybody's excited about this. We again will have your free 90-day online access NCLEX review. Okay, so let's see who will win tonight. So again, I'm telling you, so after the program, you stay over, watch out who's going to be winning, because we will post the video of the raffle in the Facebook page. So let's find out who wins tonight. I'm always very happy to receive the response from those who wins the contest, because they're really very happy. You know, you have 3 months access to our online NCLEX Academy, all the videos, all the quizzes, and all the resources that you need in order to pass your NCLEX. Okay? Okay, so before anything else, again as well, if you want your friends to benefit from this program, you can encourage them to share. And also, if you're watching the YouTube video, click like and subscribe so that you get updated with the latest videos that we have. Okay, so thank you very much, everyone, for sharing so that we spread the news to the other students who will benefit greatly from your prioritization and delegation questions in the NCLEX. Okay. Okay, so are you ready, everybody, for our first question for tonight? Okay, everybody, are you ready? So let's find out who just signed in just very quickly before we start, everyone. Okay, so we're gonna have some few people came in. Miriam Agpaua is coming from Hawaii, so she's from Hawaii. Okay, so thank you very much for being here. Okay, so we also have Claire Barker. Thank you very much, Claire, for sharing. Okay, really appreciate it. All right, so now let's have the first question for tonight. Are you ready, everyone? Say a very big yes, okay? And put a comment because if you comment, you will be in the raffle, everybody. So our very first question for tonight is going to be about I think the question is about floating. Okay, you will have questions about floating in the NCLEX. You know, floating means that one nurse, okay, a nurse from a different department in the hospital or unit is going to be working in another unit. So usually in the NCLEX, the question will be which client is best to assign to a nurse who is floating into the unit, especially among registered nurses or LPNs, for example. So I think for tonight, my example refers to the registered nurse. However, remember this, that some of the information that you learn is transferable also to your examination. Just always be aware of your scope of practice. Okay, that's the most important thing. Okay, so let's have the first question, everybody. Okay, I hope you will get the right answer on this one. So let's read the question. A nurse from the medical surgical unit is assigned to float to the intensive care unit or ICU. Which client should be assigned to the float nurse? A, the client who underwent coronary artery bypass graft 4 hours ago. B, the client who needs blood transfusion due to thrombocytopenia. C, the client who requires pulmonary artery pressure monitoring due to heart failure. Or letter D, the client with acute kidney injury who receives continuous renal replacement therapy, or CRRT. A nurse from the medical surgical nursing unit is assigned to float to the intensive care unit or ICU. Which client should be assigned to the float nurse? A, the client who underwent coronary artery bypass graft 4 hours ago. B, the client who needs blood transfusion due to thrombocytopenia. C, the client who requires pulmonary artery pressure monitoring due to heart failure. And D, the client with acute kidney injury who receives continuous renal replacement therapy. Okay, so what do you think, everybody, is the answer for this? Okay, so what do you think is the answer? A, B, C, or D? What would be a good patient or the best patient assigned to the float nurse? So why do you think you're answering A or you're answering B? Why is that the answer, everyone? Let's find out. A? All right, so let's have the answer to the question. Can you put your rationale, everyone? Why you put letter A or letter B or letter C, for example? So again, remember that one of the strategies or tips in answering questions about floating is that you have to make sure that the nurse who is floating in the unit will get patients who have predictable needs and also nursing care that is standard for any nurse. Okay, so let's have the answer, everyone. Okay, so the answer to this question, very good. I think everybody got the right answer. That would be letter B. Congratulations, everyone. Now, why is letter B the answer? B is the answer because when a nurse floats into the unit, you have to make sure that if you're the charge nurse of the unit, for example, you assign a patient to the float nurse, a patient who is stable, a patient who is predictable, and a patient who only requires basic nursing skills. Like, for example, someone coming from the medical surgical nursing unit, all nurses know how to do blood transfusion in the hospital. And then number two, administration of medications. And also nurses can do IV infusions, blood transfusion, okay, or even simple wound care. So these are skills that whichever unit you go in the hospital, you'll be able to perform. These are not specialized skills. So that's the answer why B is the answer, because blood transfusion could be something that is done in the medical surgical unit as well, or in other areas of the hospital. I really like the rationale of Jenny Ramos Pena. So she said that is a regular procedure and treatment that the float nurse do from the medical surgical unit. So very good. So you have to look at the experience of the float nurse also. So the skills and of course the scope of practice, and that has to be the stable patient. Okay, so that's it, everybody. That's the answer. So again, I told you this in the past, the three letter S's when you're floating. When someone is floating to your unit, the number one you have to look would be the skills of that person. Okay, the skills, what kind of skills? It could be basic nursing skills of the nurse, or also the skills where the person is coming from. So always remember that blood transfusion is something that is done regularly in the medical surgical unit. Okay, so that's the first S. The number two letter S is going to be a stable patient. Okay, we do not, as much as possible, allow your float nurse to do the admissions, okay, or do the complicated discharges, especially the admissions, because in when admitting a patient in a different unit, sometimes there are protocols that you need to follow. Okay, and of course any float nurse going into the unit needs a little bit of an orientation, definitely, in order to make sure that the float nurse will feel comfortable and at the same time safe to cover for the unit. Okay, so that's very important, everyone, because floating in itself is already a stressful situation for someone coming from another unit. Okay, especially if the unit that the person is going to float in is a high acuity unit. So we need to be very careful in giving assignments to these nurses who are floating. Okay, now letter A is not the answer because that client underwent coronary artery bypass. It is a fresh surgery and it is 4 hours ago. So this patient needs monitoring. Your letter C, your pulmonary pressure, artery pressure monitoring, especially with a Swan-Ganz catheter in the ICU due to heart failure, that requires at least, specialized knowledge about that. So that should be given to the regular nurses in the unit. And letter D, your client with acute kidney injury who receives continuous renal replacement therapy. That's your dialysis, everyone. Your 24-hour dialysis in that unit. So that requires also specialized knowledge and skills on how to handle that the device and the procedure as well. So congratulations, everyone, for getting letter B as the answer. Very good. So now let's go to number 2 question, everyone. Okay, so number 2 question will be this one. Are you ready for number 2, everyone? This question will be about SBAR. Okay, it's going to be about SBAR. Then also, if you're good, can you also put what country are you coming from? Okay, or what part of the United States, everyone? I would like to find out where my students are coming from, so that it's just fascinating to know, that we have students coming from different parts of the world. Okay, all right. So let's have number 2 question. The number 2 question that we have, everybody, is going to be about SBAR. Do you know that recently students have been telling me that there are questions in the NCLEX about SBAR? And of course, there will be questions about SBAR in the NCLEX because it's part of the test plan. It's a big one. When you read the test plan, it's really there, your SBAR, and you really need to know your SBAR, everyone. So we have a question about SBAR, everybody. Okay, so let's see if you can answer this question, everyone. Okay, so from San Jose, California. Hi, Chantel, how are you? Nice to see you here. Okay, all right. Joyce is from Saudi Arabia, so that's nice to know, also Joyce. Okay, so let me read the question, everyone. The nurse calls the healthcare provider to report the condition of a client with diabetes mellitus who is developing ketoacidosis. Which information will be included if the SBAR format is used during the report? A, the client needs an ABG to check for metabolic acidosis. B, the client is drowsy and has rapid labored breathing. C, the client is getting worse with severe hyperglycemia. D, the client underwent cataract extraction last month. Or E, the client is diagnosed with insulin-dependent diabetes mellitus. So this is select all that apply, everyone. Okay? Again, the nurse calls the healthcare provider to report the condition of a client with diabetes mellitus who is developing ketoacidosis. Which information will be included if the SBAR format is used during the report. Okay, select all that apply. A, the client needs an ABG to check for metabolic acidosis. B, the client is drowsy and has rapid labored breathing. C, the client is getting worse with severe hyperglycemia. D, the client underwent cataract extraction last month. Or E, the client is diagnosed with insulin-dependent diabetes mellitus. Okay? Again, so remember what is the meaning of the word or the acronym SBAR or SBAR. We use SBAR all the time in order to standardize our communication and to make sure that we don't drop the ball. We make sure that we don't have miscommunication and really relay the correct information to the person who's receiving the message. Okay? All right? So let's see who can answer this correctly. And you have to remember what is SBAR. Okay? All right. Okay, everybody. Let's see what's your answer. Always remember that your SBAR is a communication format being used in most hospital systems. We use SBAR when we call the physician. We use SBAR when we communicate to other healthcare providers or team members. We also use SBAR during documentation. So very good, Joe, for telling us what SBAR is. Okay, very good. So let's proceed, everyone. Let's see what's the answer. All right, so it seems like everybody has decided on what is the answer already. Let's see. Okay, how many of you got the right answer for this question? We still have some questions coming in. I would like to make a shout out to Alfred Seth Asuncion Tablada. We also have Maureen Cortez. Okay, Ivy Frills Nicolas. Okay, Sharon Furing, hi, thanks for being here. Okay, Modo Ginville. Okay, and Rich John Hanan Nicardo. Yay Nancy Esther Brown and Emma Domingo Guerrero. Okay, so let's now have the answer to this question, everybody. So what do you think is the answer to this question? Let's see, everyone. Okay, all right, so the answer to this question, everyone, is going to be A, B, C, and E, everybody. Okay, why do you have A, B, C, and E? A is included. The client needs an ABG to check for metabolic acidosis. Then you also have your B, C, and then your E. Now, why is A included? Number one, letter A is in SBAR. What is the meaning of R? R means recommendation, right? So when reporting, part of your report is you can make a recommendation or suggestion to the physician of what is needed. It's either getting some labs for the patient, is either giving medication or transferring the patient to the other unit of the hospital, like the ICU, for example. Okay. Now your letter B, the client is drowsy and has rapid labored breathing. That's in SBAR, that's your letter S, probably your situation. Your situation, the client is drowsy and has rapid labored breathing. So I'm reporting this because this is what I'm seeing. Okay. So the client is drowsy and has rapid labored breathing. So that's the problem that you're seeing with your patient. Okay, so there's a change in condition. So that's the situation. Your letter C, the client is getting worse with severe hyperglycemia, and that could be your A. A in SBAR is assessment. A in SBAR is assessment. It means that what do you think is going on wrong with the patient? You don't need to make a diagnosis, but you have to think. Doctor, I think this patient is getting worse with severe hyperglycemia. You don't make a diagnosis. However, you have to provide your own conclusion or your own inference on what is happening to your patient. So letter C is assessment. Assessment or your analysis of the situation of what's going on. Now, your letter E, the client is diagnosed with insulin-dependent diabetes mellitus. That's actually your background. Your letter E is your background. You give the diagnosis of your patient. Okay, so you give the primary diagnosis, and we all know that diabetic ketoacidosis is very common, especially among those with type 1 diabetes or insulin dependent diabetes, everyone. Now, why is letter D not included? So D is not included because it has no relationship to what is going on in the situation. You don't have to mention all of the diagnosis of your patient if it doesn't have any relationship to what is going on, okay? Unless the conversation continues and then the doctor asks a lot of questions, so maybe you need to get ready to give this information. But so far, again, remember that your A is your recommendation, or R. Your B is your situation, okay? Your C is your assessment, or what do you think is going on? And E is going to be your background, part of your background. Okay, so to discuss further the question, everyone, let me go over to you a little bit about SBAR. Okay, what is SBAR anyway? So SBAR actually has been adopted from the U.S. Military, I think from the U.S. Navy, and then we started using this in the hospital because the Joint Commission, when they did the research in 2012, they found out that 80%, I guess, 80% of the medical errors are caused by miscommunication. So now hospitals have to come up with a system of communication to prevent miscommunication, because 80% of medical errors, okay, is due to miscommunication. So SBAR was adopted by most hospitals, and SBAR was used especially in communicating to the physician. Okay. However, now we have come a long way. SBAR is now also being used to communicate with another, with another nurse or with another healthcare team member in your documentation. So SBAR now is all over the place. It's being practiced because it's a systematic way to standardize our communication and prevent miscommunication error or miscommunication. So situation, S stands for situation. What is the immediate issue or what's the problem? You have to tell the physician. Okay. Letter B means the background. The background is the part wherein you have to make sure that you only include information that relates to the situation, like your diagnosis, the abnormal vital signs, your assessment findings, for example, the patient's blood sugar, laboratory results. So background means anything that is related to the issue that you're reporting. So if the patient, for example, is having diarrhea or loose watery stools, then you have to provide in the background, for example, the bowel sounds of your patient, what's the color of the stool, what's the smell of the stool, okay? Your assessment is what is the problem. So the nurse, when you say assessment, then you tell the physician, I think this is what's going on. Okay, I think this patient is having a fluid deficit. I think this patient is having this problem. So you don't have to make a medical diagnosis. And if you are not sure what is going on with the patient, then it's okay to tell the physician that you are not sure of what's going on. I'm not sure what's going on with this patient. Okay, but then also it's very important to communicate urgency. You can also say that this patient is really getting worse. Okay, so you have to paint that picture to the physician or to the provider. R, lastly, is recommendation, what interventions will be done. It could either be laboratory orders, it could be medications, it could be continue the monitoring of vital signs, transferring the patient to another facility or unit, and also there's a lot more interventions. Okay, so other institutions have adopted the SBAR, and sometimes they tweak the meaning of assessment. Sometimes they use the word analysis. So my caveat is that whenever you go to another unit or to a hospital, for example, find out how they're using SBAR in their communication. Okay, so find out. But basically, this is the SBAR, and then find out how it's being modified across different areas in the healthcare system, everyone. So I hope everybody that you get a little bit of a glimpse of what is SBAR, everyone. But of course, when you're studying, make sure that you really know what SBAR is. Okay, all right. So thank you very much, everyone. I hope that you learned something from that. That was a very lengthy discussion. Okay, so let's proceed to the next question, everyone. Are you ready for question number 3? Okay, so let's see if we have people who came in. Okay, so we have a lot of people watching. Some names are familiar. I would like to give a shout out to a person that I know. Okay, when I visit the Philippines, that's hi, uh, A. Mihares Magbanwa. So nice to see you attending the class tonight. All right, so let's have another question, everyone. So this next question that we have is going to be all about, okay, we will now have your delegation, everyone. So let's see. I think most of you are doing well in delegation. I just had a student that took the NCLEX-PN, and she said everything was all about delegation, most of it. So let's read the question, everybody. Which of the following tasks may be assigned by the registered nurse to the licensed practical nurse in the heart failure unit? A. Educate the client about fluid restriction. B. Evaluate response of the client to digoxin medication. C. Interpret the lab result for B-type natriuretic peptide level. Or D. Count the heart rate before giving digoxin medication. Okay? Again, which of the following tasks may be assigned by the registered nurse to the licensed practical nurse in the heart failure unit? A. Educate the client about fluid restriction. B. Evaluate response of the client to digoxin medication. C. Interpret the lab result for B-type natriuretic peptide level. Or D. Count the heart rate. Not count the heart, but it's count the heart rate before giving the digoxin medication, everyone. Okay? So the answer for this one, we have a missing word there, count the heart rate. Okay, not count the heart. Okay. All right, everybody. So let's see the answer to this question. Most of you are getting it, I guess. Okay. So can you write down again in the comment section, especially for the new persons, joining this class? We always said in this class, RNs do not delegate, eat, evaluate, assessment, and teaching. And don't forget also planning. So planning is also for the RN. Okay. So the answer to this question, everyone, is going to be, let's see, everybody. Very good. Okay. So that would be letter D. Very good. So in the NCLEX, you should be getting this correctly. It's really very easy, everyone. Educating is something that the RN can do. But just remember that sometimes in the NCLEX, they will not use the word educate. Sometimes they will say explain to the client. Sometimes they will say discuss with the client. When it comes to education, especially if it's a new procedure, a new diagnosis, first time for the patient to hear, then it has to be the RN. Okay? Evaluating the response to any medication, that has to be the RN. That's complex thinking. Interpreting the labs, that will be for the RN. Okay? So remember, LPNs can get vital signs, they can get the heart rate, they can auscultate the bowel and heart sounds, they can do specific assessments, but all they have to do, the LPNs, is to report the finding to the RN. The RN is the one who's going to analyze everything, what is going on with the patient. Okay? All right, very good. And then last questions for tonight, everybody. Okay, very good. All right, so we have select all that apply, which is your favorite, everyone. So let me read the question. The registered nurse is assigning tasks to the licensed practical nurse and unlicensed assistive personnel in a long-term care facility. Okay. In the United States, we usually call long-term care facilities as skilled nursing facilities also. So which task can be delegated to the LPN? Select all that apply. A. Measuring fluid intake and output. B. Raising the side rails up to prevent falls. C. Applying hand mittens restraint. D. Counting narcotics at the end of the shift. E. Completing the fall risk assessment form. Or F. Discuss the care plan with the family. Okay, again, the registered nurse is assigning tasks to the licensed practical nurse and unlicensed assistive personnel in a long-term care facility. Which task can be delegated to the LPN? A. Measuring fluid intake and output. B. Raising the side rails up to prevent falls. C. Applying hand mittens restraint. D. Counting narcotics at the end of shift. E. Completing the fall risk assessment form. Or F, discuss the care plan with the family. Remember, you have an LPN here and you have a UAP as part of the team. So you want to make sure that when you're delegating everyone, you're delegating wisely. Okay? You're delegating wisely, everybody. Okay? All right. So you have a UAP and you have the LPN. So which responsibilities are you going to the LPN and to the UAP? Okay? A, B, C, or D? All right. So this seems like a challenging question for everyone. Okay? Which one will you delegate to the LPN rather? Which one will you delegate to the LPN? Okay, some of you I can see now you're getting the right answer. Some of you you're getting the right answer, everyone. Very good. Okay. All right. Always remember for LPNs, you want to delegate something that is of a higher, skill for the LPN. Okay. Don't assign the LPN something that the UAP can do. You want to make sure that LPNs are doing something that that they are supposed to be doing as trained. If you can assign it to the UAP, give it to the UAP. Don't let the LPN do it, because delegation is all about the wise use of resources, making sure that people are doing work, okay, that they're supposed to do. Some of you are getting the right answer though. Okay. All right, so let's see the answer to this question, everyone. Okay. It seems like it's a challenging question for everybody, huh? Okay. Always remember this also in the NCLEX, that for select all that apply questions in the NCLEX, it's either possibly all of them are correct or only one is correct. Okay, so always remember that. Okay. All right, so the answer, I think I only saw one person who got the right answer for tonight. Okay, and the right answer is going to be, okay, all right. The answer is going to be letter. Let's see who got the right answer for tonight. Okay. So the answer is going to be only letter D, everybody. Okay. I think one person got this right. Okay. It was Mulo Hadera, I guess. She got the correct answer. Very good for you. She got the answer, which is only letter D. Very good, Mulo. Congratulations. Let's congratulate her for getting the right answer, guys. Okay. Now, your fluid intake and output measurement. Remember, you have UAP and then you have your LPN. Routine measuring of fluid intake and output could be given to the UAP. Okay. Routine vital signs, routine intake and output, routine weight and height measurement. That could be for the UAP. Raising the sidewalls up, you can give that to the UAP. It's very easy to raise the sidewalls up. You don't need an LPN to do that. Applying hand mittens, of course, UAPs can apply hand mittens. So letter D is the answer, because your UAP can count narcotics or should count narcotics at the end of shift, especially oral medications. You have to count at the end of shift to make sure that they are complete. You have to take note how many narcotics are left, and which patient received narcotics at the end of the shift. Okay, so to continue, everyone, your letter E, completing the full risk assessment form. That is assessment form. That is to be for the RN, right? Always remember assessment. Okay, assessment form. Okay, so that will be for the RN, and then also discussing the care plan with the family. So that would be for the RN also. Okay, so discussing the care plan or even developing the care plan, that would be for the RN. Okay, so the answer only here, everyone, is going to be only letter D, only, everyone. Okay, now RNs can count narcotics, of course, but then however, it's within the scope of practice that LPNs can count narcotics because they are the ones giving oral medications, right? Okay, so very good. So that's the answer, everybody. Okay, so thank you very much, everyone. So before we end for tonight and announce the winner for last week, so we have again our program. which is the NCLEX Success Workbook and the online NCLEX Academy. So we have the workbook is $94.50, and then we have the subscription every month, which is $49, and it includes a lot of resources for you guys to pass your NCLEX. And of course, coming February, I think we're having another sale, so please wait for that. It's going to be the President's Sale, I guess. So we'll be announcing that to you guys. Okay, so we have just shipped some workbooks this week, and it's exciting because our students really enjoy the workbook, everyone. Okay, all right. And then, of course, another one, if you want to get our shirts also, so we have our merchandise. We have the I Can Do It, so positivity and nothing will stop me. Okay, so if you want the shirt, you can visit Matus Nursing Review online, NCLEXacademy.com, and then you can buy the shirt, everybody. Okay, all right. And of course, for last week, our winner was, okay, Oni Alfonso. We announced him immediately after the Facebook Live. So thank you very much, and Oni, for contacting us. And then I hope that you are enjoying the online academy at this time. And if you have time, if you can give a testimonial. Okay. All right. So thank you very much, everyone. I would just like to give a shout out to a lot of our students tonight. And I hope you learned something about floating and something about SBAR. Those are very important in your NCLEX. Okay. And I think you need to keep on mastering again your delegation to the UAP. All right. Well, it keeps, it requires constant practice, everyone, until you really get the strategy or the concepts, everybody. Okay, so thank you very much. Okay, so everyone, thank you very much again. I've said that a million times, and this is again Mr. Alan Matus, wherein we provide NCLEX review, simple, fast, and easy NCLEX review for everyone. Thank you very much, and have a good night, everybody.